Well, good afternoon. I'm Mayor Joe McComb, and we'll call our weekly COVID update briefing to order for December the 1st. And if you look, it's, as they say, it's beginning to look a lot like Christmas. And we're all looking forward to the holidays. And one of the things about, at least the folks in Corpus Christi, is we're pretty resilient. And even though we've been fighting COVID for several months, and I don't want to use that as an excuse to be discouraged, because I don't think we are. We're getting close to the end, but we're not going to let that interfere with our holidays and the celebration, and so we're going to be able to protect ourselves and enjoy the holidays. So we just want to continue to keep you updated, keep you reminded of the fact that we are in a pandemic, and to continue to follow the protocols in which we've been going over the last several months. But Annette Rodriguez, the director of our health district, gave us some pretty good news today at the city council meeting. I don't know if she'll go into a lot of detail about that today in addition to what her normal report is going to be, but the bottom line is that the vaccines look like they're in the process shortly now. I don't know how shortly that is, but the plans are being made for the distribution and for the administration of the vaccines to fight COVID, hopefully before the end of the year to begin. And is that an accurate statement? I think they're looking at hopefully some before the end of the year. And they have been working for months, communicating with the federal government and the state government and our local health department and health providers and organizations that are going to be available to participate in the vaccinations, to set up all the logistics so that when the vaccine does arrive, we can begin just right away meeting the needs of the people in the health industry as well in terms of the priorities, and ultimately get to the general public. And so we're excited about that. We need to still be patient, but and all the information that we've been able to receive so far is that the vaccines have a better than 95% positive outcomes with very minimal negative reactions. And so we think that's good news for our community and for our country. So we're looking forward to that. But I would encourage you, if you do your shopping and for Christmas, take all the precautionary measures that you can. Try to go at off-peak times if possible. And let me put in a word for our local merchants. Please try to buy as much as you can locally. I know it's tempting to get on the computer and order online, but the local folks here employ your neighbors and your friends and your relatives, and we'd like for you to spend your money locally because that's part of helping people make Christmas, because they have salaries to pay and they have bills to pay, and their employees need to make sure that they have their jobs. And so working all together, we can make this thing livable and a little more painless as we go through it. But with the announcement of the vaccines on its way shortly, that makes 2021 look a whole lot brighter than 2020. So keep that in mind, but continue to stay tuned for this information and your diligence in taking care of yourself and your family. It really will pay off in the long run. So at this time, I think Judge Canales got detained, but there'll be a presentation of the information that she had for you, and then following that, Annette Rodriguez will come up and give us the statistics and the information that we have for today. And then our Texas A&M Corpus Christi folks will come and share the information that they have. And again, we're seeing some uptick. Fortunately, that the numbers are down from what they were over the weekend, but they're still too high. One is too many. Our goal is to have 0, and so we need your help. And with your help, we're going to win this thing. And I don't know that we've rounded third yet, headed for home, but we're getting close. And so stay with us. And Annette, if you'll come at this time and give them the information that you have. Thank you very much.
Ya estamos preparados para Navidad y nuestra población ha sido muy resistente, aunque eso no significa que baje la guardia. Tenemos buenas noticias en cuanto a la vacuna para prevenir el COVID, información que dará la directora del Departamento de Salud, aunque esperamos contar con la vacuna antes de que culmine el año, lo que nos da mucho gusto. También es prometedor saber que la vacuna ha demostrado una eficacia de más del 95%. Recuerde, si va a ir de compras, vaya cuando hay menos gente y le sugiero comprar localmente, ya que así ayudará a impulsar la economía. Ahora la directora del Departamento de Salud nos va a dar su reporte.
Good evening, Annette Rodriguez, Public Health Director. I'm going to go ahead and start with the COVID-19 statistics. First slide, please. So this basically shows over the last 2 weeks our daily COVID-19 cases. So if you look on the far side on November the 18th, 172 cases, 200, 200, 180, 130, 120, 140, 180, 121. And now our numbers seem to get a little better. And so this definitely is improvement. So if you look over the last 7 days, that daily average has dropped to 131. Because if you look at the 7-day prior, they're going to be higher, the daily average, because of those 200 numbers. So our numbers are, relatively speaking, they went up fairly quickly over 200, but now they've dropped a little bit. So thank you all for all your hard work in keeping those numbers down. Next slide, please. So this diagram basically shows 2,254 active cases. That's taking the total Nueces County cases of 24,664. That's subtracting out the 21,921 that have recovered, and then the 489 that have lost their lives to COVID-19, which leaves you the active case numbers of people that are still in Nueces County battling COVID-19. Next slide. This shows the hospitalizations, and as you can see, we've gone from 2 weeks ago, 107 hospitalized. We've gone up, we've kind of gone down a little bit, and we're kind of, still at 115. So these are the hospitalizations of COVID-19 patients over the last 2 weeks. Next slide, please. These are the individuals that have been in the ICU. So 2 weeks ago, 34 were in the ICU. It went up to 39. It went further up to 47. It's kind of dropped back down, was up to 44 November the 28th. And today there are 39 actual individuals in the ICU battling COVID-19. Next slide. And there were no deaths today related to COVID-19. But we do have a total cumulative deaths for Nueces County of 489. So I'm going to talk a little bit about the health district and what we have currently going on. So today the health district had our COVID-19 drive-through testing this morning at 6:30 a.m. A total of 74 individuals were tested and 38 results were positive for a positivity rate of 51%. This number is actually a very high increase to what we normally see, which is usually around 25%. Any residents that are experiencing COVID-19 symptoms can self-register for testing at cctexas.com by clicking on the Register for Drive-Through link. So our seasonal flu numbers are still very low compared to the same time period last year. The flu is still circulating in the community. We're still seeing flu A and flu B. It's not too late to get your flu shot, though. The flu vaccine has a lot of benefits, including reducing the risk of getting severe illness due to the flu. And with both viruses circulating, it's even more important to protect yourself from getting co-infected with seasonal flu and COVID-19. So please, if you haven't been vaccinated, get vaccinated. So to turn now to the 2 COVID-19 vaccine candidates that have applied for the emergency use authorization and are expected to be approved by the FDA soon. Like the mayor said, this is really great news for all of us, even though we know that it's going to trickle in probably at the beginning, and then we'll see more as the manufacturers make more vaccines. So based on the current timeline, COVID vaccines may be available for distribution as early as December the 14th. So the first one that applied for the EUA was Pfizer, and so we're expecting to receive some of that vaccine once approved by the 14th. Then also Moderna just applied for emergency use authorization yesterday. They are going to meet, the FDA is going to meet, and then they should be approved, and we should receive that vaccine on December 21st. So about a week after Pfizer's vaccine come, then we should also get some from Moderna. The first group of people to receive the COVID-19 vaccine will be hospital personnel. These are the individuals that are treating the COVID patients and all the ancillary groups that go with that. So if you have an X-ray technician, if you have a lab technician, those individuals that are working with the COVID patients will also get vaccinated. EMS and nursing home personnel as well. As more vaccines become available, more eligible categories will be identified by the Commissioner of Health for the state of Texas that can then be vaccinated. So public health is very excited about the arrival of the COVID-19 vaccine, and we have some important facts to share with you. The COVID-19 vaccine does not give you COVID-19 virus. The COVID-19 vaccine does not use live COVID-19 virus when being manufactured. The COVID-19 vaccine does prevent you from getting COVID-19. It also does protect you by boosting your immune system into making antibodies against COVID-19. The COVID-19 vaccine does take about 2 weeks after your last dose for you to reach optimal protection against COVID. Like many vaccines, there may be some adverse reactions to the COVID-19 vaccine, such as pain, swelling, or redness in the arm, mild fever, possibly nausea, chills, fatigue, headache, muscle and joint aches. While waiting for the vaccine to arrive, public health urges everyone to continue practicing the preventive measures that help decrease the spread of disease in our community. Stay at home when possible. If sick, stay home. Watch your distance, stay at least 6 feet away from others or further if possible. Wear your mask appropriately over your nose and mouth. Wash your hands often with soap and water. Avoid large gatherings. Take care of yourself and in turn take care of others. Together we will succeed in halting this virus so that we can all have our lives back. Stay determined, stay strong, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 77 casos confirmados por el coronavirus. 21.921 pacientes se han recuperado por completo. 115 personas continúan en el hospital. 39 están en la unidad de cuidados intensivos. 2.254 son casos aún activos. El día de hoy, afortunadamente, se reportan 0 fallecidos. A la fecha, los fallecimientos totalizan 489 personas. El día de hoy se llevó a cabo la toma de especímenes y 38 de 74 resultaron positivos. Si usted experimenta síntomas y quiere registrarse, puede hacerlo en la dirección www.cctexas.com o llamando al 826-7200. El Departamento de Salud le exhorta en tomar la vacuna contra la gripe, ya que tiene muchos beneficios, como la reducción del riesgo de enfermarse gravemente, especialmente con ambos virus circulando en esta temporada. Una vez que la vacuna contra el COVID-19 esté aprobada, será distribuida primero al personal médico, servicios de emergencias y asilos para ancianos. Posteriormente se distribuirá en cuanto a prioridades y en cuanto a su disponibilidad. Es importante recalcar que la vacuna contra el COVID-19 no le transmite el virus, no causa el virus COVID-19 vivo cuando se fabrica. No se usa el virus. Evita que se contraiga el COVID-19. Sí lo protege al estimular su sistema inmunológico para que produzca anticuerpos. Toma alrededor de 2 semanas después de su última dosis para que usted alcance una protección óptima. Como muchas vacunas, puede haber algunas reacciones adversas a la vacuna COVID-19, como dolor o hinchazón o enrojecimiento donde se aplicó la inyección, fiebre leve, náuseas, escalofríos, fatiga, dolor de cabeza, dolores musculares y articulares. Mientras la vacuna está disponible, le recordamos tomar todas sus medidas de salubridad para evitar contagios. Ahora el doctor Chris Bird nos va a dar su pronóstico en cuanto a casos positivos en nuestra área.
Right, good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Pandemic Task Force. We have two task force objectives. One is to address public concerns and questions about COVID-19 and the interventions that are taking place to combat the pandemic, and two, to enable evidence-based decision-making on behalf of local leaders. So there's a lot of interventions that are in place. You're urged to stay at home if you can right now, especially if you're over 65. Face coverings and social distancing rules are still in place. You're encouraged to isolate when exposed to somebody who's had COVID-19 or when you're symptomatic until you contact your healthcare professional, get tested, and get the result of that test. Make sure that you don't go out while you're waiting for the result of that test. We have partial remote schooling taking place. We're not back to full face-to-face. And we're at Open Texas Phase 3, which means that about 75% capacity is allowed in most businesses, and bars are open at 50% capacity. So we continue to increase in the number of cases. This week we're up 31% over last week in terms of the number of active cases in the Coastal Bend area. These are confirmed cases that were determined by the PCR test and doesn't include probable and suspected positives. Although something that I was made aware of fairly recently is that a suspected or probable positive could become a confirmed case if they get a PCR test after that initial suspected test. So it's something to consider. We're at 759 fatalities in the Coastal Bend as a whole. This is, it feels like a really high number, more than about 1 or 1.5 in every 1,000 people in the Coastal Bend has died from COVID-19. And when you look at the rate relative to how many people have tested positive, it becomes even much higher. So in terms of our projections and the number of cases, this figure shows the number of new confirmed cases with the black points, and then we have two projections. One is based upon there having been no effect of the Thanksgiving holiday on our projection, and the other, which is a little bit higher, the redder one, is if we had celebrated Thanksgiving normally, like we would have in 2019, or like we're going to in 2021. And you can see that it results in quite a few more cases at the peak on average. Right now, the black dots are following both projections fairly closely, and we'll see through time if the cases continue to match one projection better or the other. But for right now, they both predict about the same thing presently, and the cases match it very closely. So we're going on 4 to 5 weeks that we haven't made any changes to the dark brown line. That's our model projection. Things are proceeding as we expected. And we see nothing to really indicate that we're going to see a deviation from this projection yet. Going on to the number of inpatients in the Coastal Bend area, this is a similar figure where the black points are the number of people that are in the hospital each day in the Coastal Bend with COVID-19, and they're confirmed. And the lines, again, represent the two scenarios of a normal Thanksgiving in bright red and no effect of Thanksgiving on the current outbreak in brown. And what you can see with the black points, your eyes don't deceive you, we had sort of a decline in the number of hospitalized COVID patients over the past week. And it is, if you look really, really closely, you can see that's starting to increase again, and we will see if that trend continues. We expect that it will, but here's hoping that we more go down than up. I would like nothing more than for this projection to be wrong and be too high. But for right now, we expect that the number of inpatients are going to start to increase again. When we look at the number of fatalities, and I think you could kind of see it in the city figures from earlier, but the fatalities are starting to increase. As predicted on this graph, the black points are the number of actual new fatalities recorded on a given day. And then we have our two projections. We expect that the fatalities are going to start to increase. Remember, fatalities lag hospitalizations, which lag people testing positive, which lags when they got infected in the first place. So now we're looking at something that's 21 days in the past, 28 days in the past where people initially got infected. So that's why you see these types of delays where the cases are up, but the fatalities are down right now, but they're going to go up. Zooming in on the local area and the number of positive tests and the positivity rate, I don't believe the latest data point was included in this data set, where we have about 22% of the people getting tested by the public health department being positive. You heard that number was much higher today, around 50%. And at the mobile testing stations, we're at about 18% average positivity of the people getting tested. These rates are really high, and a 50% rate is super high. And so make no mistake, COVID is here. We're in an outbreak here in the Coastal Bend area, and people should act accordingly. This is a new figure that we haven't shown, at least we haven't shown it in months as far as I can remember. What you're seeing, each point is the number of people per capita or per 100,000 in a given age group that tested positive on a particular day. So these are the new cases of COVID by age group. And we did it per capita, so you could see relative to how many people there are between 0 and 19 and above 80 years old, what proportion of those people are testing positive. And what you can see is that over on the left by October, this kind of started, the outbreak we're in started with rises in COVID cases among people that were 80 and 60 to 79, really people above 60 years old. And you can see a slight peak over there before people of other ages started to increase, while the people above 60 kind of plateaued, and now the people above 60 are rising again more quickly than most of the other age classes. So that is the fuchsia color and the blue color that we're looking at. And then for the greens, you have 20 to 39 and 40 to 59. Those are the age classes where most people per capita are testing positive. And at the bottom, you have people between 0 and 19 years old, where they're the lowest proportion of people that are testing positive. So there's some pretty interesting patterns going on here, but this kind of lets you know by age group who's getting affected, and really everybody is getting affected right now, regardless of your age, by COVID-19. When you look at the Coastal Bend area, and this is the number of new cases broken down by county, it's not per capita, it's just straight up new cases. You can see that Nueces continues to rise. Now you might say, well, but really recently it's kind of leveled off or gone down, and you saw that in the graphs that Public Health Director Rodriguez showed earlier. But you kind of have to step back and not be a prisoner of the moment and see the greater pattern. If you step back and you look at that line, basically it's going up over this period of time that we're looking at, and we have no reason to believe that's going to stop going up in the future. So we don't think that it's going to continue to curve downwards. We project that it's going to continue to go up. We're to the point where next week we won't show Nueces and the other counties in the Coastal Bend on the same graph, just kind of like we were in the summer outbreak, where the number of cases is getting too high to even see what's happening in the other counties in the Coastal Bend. Realize there are 11 other counties in the Coastal Bend, and these cases do add up across them to be pretty close to the same amount of cases as there are in Nueces total. So we're definitely in an outbreak right now. One thing we're particularly concerned about are the people in the ICU, and do we have the ICU capacity to handle it? And right now we definitely have the ICU capacity to handle the COVID patients. They're in place, they've increased over the past couple weeks. And again, don't become a prisoner of the moment and see, oh, in the last 4 days it's decreased. The overall trend when you're looking at this is increase. And again, the models and everything we know about what's happening, there's no new interventions taking place that we know of right now. We expect that these numbers will continue to increase. But we're well within the amount of patients that we can handle in the Coastal Bend right now. And you can see what it was like back just after July there, where there was really a large number of COVID patients. The blue dashed line represents, on average, how many patients there were in the ICU before any of these outbreaks, the summer outbreak or the fall outbreak. And you can see that we actually passed that number in just COVID patients in the summer. And it's possible that we might be headed that way again now. And this is why we're asking everybody to social distance, be careful, wear your masks, and if we really do our part here, we could change the future of this curve. The last thing that I want to show you is some travel patterns. It takes a little while to get the cell phone data for travel patterns to different locations. So what I'm showing you now is a heat map across the United States of where people from the coastal bend traveled to. The units that we're measuring here are in visits, and a visit could be to any sort of establishment that's listed in the database that we're using. So if somebody traveled from one place in the coastal bend to another, you can see that hot spot right where we are in the coastal bend. There's a lot of travel going on there. And as you spread out across the country, you can see that people from the coastal bend traveled, and this is the weekend before Thanksgiving, they traveled to almost every corner of the United States. So as people are traveling, they go to these different parts of the country, and then they come back. And this is something that we're watching and we're concerned about. Next week, we'll be able to show you the graph like this for Thanksgiving weekend itself. But for now, this is the weekend before Thanksgiving, where a lot of people do their travel for Thanksgiving, and they spend their whole week with their family or wherever they're going to celebrate Thanksgiving. So with that, we'll go to a translation.
Las cifras a continuación reflejan los casos de 12 condados del área sur del estado. En el área de la costa se han reportado 27.639 casos a la fecha, 24.517 son recuperaciones. Casos activos aumentaron un 31% comparado a la semana pasada. 759 personas han fallecido a la fecha. El número de casos ha estado manifestándose como se había pronosticado. 42 personas se encuentran en la unidad de cuidados intensivos. El número de fallecimientos también ha comenzado a aumentar. El rango de edades con mayor número de casos positivos se encuentra entre los 40 a los 59 años, seguido por mayores de los 80 años. El condado de Nueces es el condado en el área de la costa con el mayor número de casos nuevos, mientras que los pacientes que son internados en la unidad de cuidados intensivos también han estado aumentando. Se estima que durante la semana del 11 al 15 de noviembre, o sea, una semana antes del Día de Acción de Gracias, más de 110.850 personas visitaron otra ciudad por parte del área de la costa.
Okay, we typically end the presentation with questions from the crowd on Facebook. Let's see, I think we need to get our act together here, but I believe we're not going to answer questions today. Oh, we are going to answer questions today, so that's where you need to help me out, Dave.
Yeah, so we're going to ask a few questions today, but we also want to let Facebook audience know about Friday's question and answer.
So we're transitioning here in the way the task force gets its message out, and we'll be presenting like we did today, next Tuesday, but then after that we're going to all social media. So we're going to start a live Q&A on Fridays at noontime. And some of the questions that we would normally answer today, we will answer on Friday at noon. It will be myself and Director Rodriguez of the Public Health Department. And you can find that on CB COVID. You can go, you'll be able to find the link to CB COVID on Twitter or Instagram or Facebook, and we'll have a link there to the live stream or the recording of the live stream if you can't tune in at noontime on Fridays, where we'll answer questions that were posed during the week on social media, as well as we'll take live questions during the noontime question and answer session. So with that, I think we'll have a few questions, most likely for Public Health Director Rodriguez.
Yeah, there is a question though on when we monitor the travel, do we monitor any international travel coming in?
So Right now, the way that I understand it, the only travel that I presented was from people from the coastal bend where they traveled to. We didn't track it internationally, just within the 48 contiguous United States.
And so there's a question about, kind of worded funny here, but what dates were people tested after Thanksgiving? And was this testing done over the weekend? And how long will it be before those tests show up in our predictions?
Okay, so the health district tested on Saturday, and those results are already in the statistics that we showed. The only ones that are lagging are the ones that were just reported out in the evening, so later today, and those will report out tomorrow, and those numbers.
And how will that, in that line, how will that affect the results you get, Dr. Bird?
Well, presuming that less people got tested on Thanksgiving, and during that holiday, we expected there to be a little bit of a lull in things like the number of people testing positive. We won't adjust any projections until there's a clear deviation in the number of cases, the number of new cases that is, just clearly not matching the model anymore. But so far, I'm actually surprised how closely the case data has continued to match the model despite the Thanksgiving holiday.
Real quickly, Annette, how does the Corpus Christi local authorities know who is going to get vaccinated first? There was a post by the city where you talked about it in a YouTube video, so they have that link when you discussed it last time, but for the audience today, can you quickly?
Right, so there's the Phase 1A, Tier 1, and that's going to be the hospital care personnel that are actually working with COVID-19 patients, as well as ancillary staff, X-ray techs, laboratory techs, custodians, et cetera. They will all get vaccinated first, as well as EMS personnel, as well as nursing home personnel, because they're with a very vulnerable population, as well as hospice and those types of facilities that work very closely with COVID-19. That's in the Tier 1. And then in the Tier 2, you're going to have like the physician's office and their staff, because they're still seeing COVID-19 patients, but not to the extent that the hospitals are. You're going to have public health staff who's out there, with the COVID drive-thrus, and several other groups that I don't have on the top of my head, but we do have that posted on our website, so they can get it at cctexas.com.
And lastly, how long do you test positive for? Are you infectious for more than 3 weeks?
How long do you test positive for? So if you test positive and you haven't completely recovered, in 2 or 3 weeks, you still could test positive again. But if you have recovered, or you feel like your symptoms have gone away, and you haven't had fever for at least 24 hours, the last 24 hours, you are considered recovered, and you can go back out into the community. Even though you may still test positive again, you just don't have enough virus in you, you're not viremic enough to pass it to others. So, and CDC today also changed the quarantine. It used to be everybody knew at 2 to 14 days you had to be in quarantine if you were exposed to somebody positive for COVID-19. That has now been changed to 10 days. So, and it also can be 7 days if you test negative between 7 and 10 days. So we'll look at that a little bit more closely. But now the isolation, if you're positive, you have to be in isolation for 10 days. If you're exposed to a positive, you have to be in quarantine for 10 days. No more 14 days.
And just to add on to that, it matters the type of test that you have. If you have the antibody test, you could test positive for months after you're infectious or sick with COVID-19. Everything that Director Rodriguez talked about was for the other 2 tests, for the PCR test and the antigen test.
That's correct.
There was a couple other questions, but I think they'd be better asked on Friday's question and answer time.
Okay, thank you.
All right, a viewer told us last Friday that there was a shortage of hospital rooms at Spawn South due to the high numbers of COVID-19 and expecting mothers as well. To your knowledge, do you know if that's true? And do you know if there's if other hospitals are dealing with room shortages due to the high numbers?
Yes, so there's shortages in many, many hospitals across Texas and across other parts of the United States. Spawn South initially was not really ever intended to be a hospital for COVID-19 patients. It was really more shoreline. And so they've, opened up the capacity to be able to care for some COVID-19 patients there. But like all the other hospital, there is, capacity concerns with our numbers increasing this second wave. Any other questions? Seeing none, so thank you very much. Thank you for being with us this evening, and we will see you next Tuesday. Appreciate you being here.